I was born and raised in Greenville. My dad was a Donaldson Air Force man back in the 50s, so this is home. I've been a lot of places over, the years that I've been in school and training and traveling. Med school in Charleston at MUSC, and then went to Memphis, Tennessee for residency, but then came back as soon as I was finished and, always wanted to practice and live here. The beauty of the area, the friendliness of the people, and the more places I go, the more I realize how good we really have it here. One of the best parts of my job, I think, is getting to meet so many nice people. They're just a delight to take care of. They come to me and a lot of them are in a lot of pain. There's a lot of pain management involved in surgery. The most rewarding thing is to start off with a patient who's miserable and then diagnose the problem, and then actually be able to go into the body and fix the problem. And then they get better and they come back to your office and they're no longer in a wheelchair. They're back to playing golf and mowing the lawn. They're happy. They're back to where they want to be as far as their quality of life. To be able to make that kind of difference for just one person is worth everything. I'm really about minimally invasive surgery. I like to do things with small incisions, minimal disruption to the tissues whenever I can. And there are a lot of options for that in this day and age. I operate from the skull base all the way down to the tailbone, doing all kinds of different approaches in every different part of the spine. These problems in the spine oftentimes have evolved over a period of years. And so you have to unravel that and then correlate what the patient is telling you and what's on their physical exam with what I see on that imaging. And then, based on all that, decide what of a whole range of different procedures is going to be best for that individual patient. That's something that we excel at doing in the Spine Center at Pelham. Spine problems, whether it's in the neck or the back or the thoracic, spine problems are very individual. So each person has their own array of symptoms, their own individual anatomy, their own individual problem. And sometimes you can have a really bad looking set of images, like an MRI scan, and yet the person really doesn't have much in the way of symptoms at all. Then on the other hand, sometimes you can have really bad symptoms and an MRI that doesn't look too awfully bad. So this is one of those things where you really have to look at the images, see the patient in the office, listen to what they had to say about their symptoms, do a physical exam, to see how that correlates with everything else. It's really detective work, putting all the pieces of the puzzle together to figure out, is what I see on those images actually the source of the pain? And if so, is it bad enough to consider surgery? What might be other options? If it is bad enough to consider surgery, what would be the best approach in that particular patient? Coming to see me, even though I'm a neurosurgeon and surgeon is part of what I do, you're not committing yourself to having a surgery just by coming and talking to me and letting me evaluate things. It's probably better to just come on in and evaluate the situation, go over everything and see what the problem is, so you understand what's going on, understand what's likely to happen in the future, and understand what your options are. And at that point, you may not even need any treatment, or it may be something as easy as a physical therapy or an oral medication. But at least you can understand what your problem is, and also have a resource if it gets worse or things change. You can always call me back and we can look at the situation again anytime. Of course, you have to know how to do all the procedures and how to diagnose things and manage complications. But I think, to me, the most important thing is being able to communicate well with the patients, because at the end of the day, the patient comes in and just really wants to know that somebody cares about what's happening to them and cares about their outcome. I think that's part of what makes my patients so loyal. I've moved my practice now twice in 21 years, and my patients overwhelmingly for the most part have followed me. And I think that's the reason why, because you do develop a very strong bond. There are families out there that I've treated 5 or 6 of their family members. So a lot of patients become almost like friends. And that's really what it should be about. There should be that element of caring and that element of a relationship between the patient and the physician.